appreciate Chase and the team at Hannah Resource Group. We appreciate you guys being here. The series has been so good. I've learned a lot. I know our members have too. And I just think about the breadth of the topics that your team has covered. And I so appreciate all you've done to prepare for this webinar series and answer our questions. And I think that this is going to be a great topic and very timely, as I know everyone's preparing for open enrollment season.
Good. Yes. Hopefully it'll meet the needs. Yeah, and then you guys record these and then you share it broadly afterwards, right? So
Absolutely,
hopefully people are
yes.
getting those resources when they can have a few minutes to spare. But we'll go ahead and get started. So yes, to Ashley's point, the timely nature of this is all about how to plan for a better open enrollment season, just best practice and some tips and tricks from Allison on our team at HRG. Allison is, I'm going to read the whole bio, but I'll just do a quick summary. So Allison's our director of HR operations here at Hannah Resource Group. So she also has served as the HR leader and director of a number of different organizations, as well as, all the outsourcing things that we get asked to do. So she's got a huge breadth of experience. Obviously, she has her PHR and her SHRM CP, and we love Allison because she knows a little bit about everything. But one of her specialty areas is benefits and compliance compliance related issues. So I will let Allison go ahead and start.
Awesome. Thank you so much, Chase, and hi, everyone. So like Chase said, I've done a lot of HR outsourcing, which is kind of helping groups that are too small to have a full-time person do HR. So I've been both fortunate and unfortunate to be involved in what feels like hundreds of open enrollments at this point with all kinds of different plans, different groups, different carriers, different brokers. So definitely have been in the hot seat multiple times. And what I tried to bring to this presentation particularly, because as Ashley mentioned, we kind of already are in the middle of open enrollment season. If you haven't already gotten a renewal, you're probably very anxiously waiting on it at this point if you're a 1/1 renewal. My goal is not to give tips like negotiate a better rate or switch to level funded plans, because those are really big picture items that a lot of times are out of your control or should have already been decided by the time you're ready to launch open enrollment. Instead, what I'm planning to talk about are just tips and tricks, things that you can think about to help you implement your open enrollment a little bit more efficiently or differently, communicate a little bit better or increase engagement. And not every one of these will be applicable to every group. It's really going to vary based on your size and your demographic population, but the goal is for every person to leave with at least one or two tools or ideas that would work for your group that you can implement really easily. So we're going to talk about a couple of key trends and challenges in open enrollment. We're going to talk about communication strategies and ways to boost engagement. And then we're going to do a couple of just best practice and actionable tips to help streamline the process at the end. And Chase or Vicki, feel free to weigh in as well. If anyone has questions, as always, feel free to speak up. So we all know rising healthcare costs and inflation pressures are one of our pain points. And we're anticipating, maybe not in the really short term, but in the longer term, that there will be some changes to access to care for employees as some of these subsidies go away and some of the clinics or practices that depend on those subsidies in order to offer care start to kind of lose that funding and close down. Access to care may change for some of the employees. But again, with this renewal cycle so far, hopefully we haven't seen the crazy increases we were expecting, but we do anticipate that to come in future years. And then generational differences in benefit expectations. We could spend a 2-hour presentation talking about the differences and what a Gen Zer wants versus a Gen Xer versus a millennial. Like we could talk all day. What I'm going to do though is just point out that is, of course, something you want to consider, the generations that are in your workforce. And we'll talk a little bit about later about places that they overlap and ways that you can understand from them what is important to them. Increasing demand for voluntary benefits. This is very much a millennial Gen Z. They are loving having flexible benefits, mental health access, student loan assistance. So making sure that you are keeping voluntary benefits on your radar during open enrollment. It's so easy for health, vision, and dental to kind of take over the scene, but keeping those other supplemental and voluntary benefits in the forefront as well when you're thinking through your open enrollment is going to be really key for those younger demographics. Then employee confusion and decision fatigue. We'll talk a little bit about that. I know it's fatiguing for not just the employees, but as HR professionals, there's a million options out there. Every open enrollment is really complex, and it becomes really difficult sometimes for you to even to come up with the communications to explain it to employees. So we're going to talk a little bit about some ways to make that easier. And then tight timelines on quotes. Again, I mentioned at the beginning, if you haven't already gotten your renewal, you're probably anxiously waiting on it. I'm currently working with 3 clients on open enrollment, and only one of them has received the final thus far, and they are all 1/1 dates. So we're not only a little anxious about what the final number is going to be, but we're anxious about having to make decisions in a really quick turnaround. So again, that's why the focus of this is really things that you can control, because some of this you can't. So when it comes to generations, I was just reading an article from Forbes, and it was really interesting. I thought to call out the top 3 things that all the generations had in common. So 79% of all workers said flexible work is one of the most important benefits to their satisfaction. So that is outside of health, vision, dental entirely. 64% highlighted the need for flexible parental leave outside of the open enrollment entirely. And then 62% emphasize access to mental health resources. So that is something you want to keep in mind as you're looking at your options and communicating out, is focusing on the mental health resources, because that is something that all the generations really are valuing. So we're going to start simplifying communication and boosting engagement. So is there anyone on the call who uses Employee Navigator currently? Or has their open enrollment embedded in their HRIS system? Well, I like to bring this up because if you're doing paper and it's working, great. If you're doing paper and it's not, which is normally the case, talking to your broker about whether or not Employee Navigator is a tool that they offer as part of their kind of suite of services is a really good place to start. Some brokers will offer Employee Navigator for free if you are using their services. Some you can roll it up with your supplemental or voluntary benefits. Some you have to pay a small fee, but Employee Navigator is incredibly helpful because it allows the benefits broker to upload all of the plan information on the back end, and then your employees can make their elections digitally, and then you can run a report, approve it, and it goes to the carriers. So it can bolt on to some HRIS systems, but it can also be a standalone product. So it's been really helpful for especially smaller groups who either don't have the HRIS functionality or don't want to pay for it, to try to use Employee Navigator. So that's not the only tool out there. There are other ones that will do similar open enrollment support services, but it's definitely worth starting with your broker and seeing if they have any recommendations or if they can hook you up with any kind of a discount. If you do have an HRIS system that you are utilizing for open enrollment, if you have multiple plans, a thing to potentially think about is utilizing the AI in the open enrollment process. And I say that because like Paylocity, for example, has an AI function where you can upload your plans and it will build a questionnaire for employees. And any employee that doesn't know what they want to enroll in can go through this checklist plan questionnaire, and it will make a recommendation for them. So it's going to help employees be thinking about what's best for them. It's going to help them get a tailored recommendation that you don't have to do.
Looks like somebody is using Employee Navigator in the chat, Allison.
Oh, great.
Yeah.
Awesome. Hopefully they've had a good experience because it's been really helpful for the clients that have utilized it. So patient advocate options. This is another thing. Your all's broker is probably going to be upset that they're getting this many questions this close to open enrollment, but it's worth asking if any of the carriers or plans that you're currently working with offer any kind of patient advocate option. So for example, one of the health plans that one of my clients is on comes with something called My Advocate. And what I have included here is a snip of what My Advocate does. And my favorite are right here in the corner. It assists with benefits comparisons, so it helps them ensure they're enrolling in the best fit plan. It explains the drug prescription formulary, so if anyone is on prescriptions that they need to verify are covered by the plan, they can reach out to the My Advocate, and guides them through health savings account and flexible spending accounts so they can weigh those options. So this is not an additional cost under this carrier and plan. It is not the only one that exists. My Advocate is not the only tool like this, but again, just kind of asking your broker, hey, are there any advocate options, any patient care options? And you can send employees that way. They are really great. They provide a really robust service, and it's going to take questions off of your plate. Similarly, if your plan does not offer patient advocate options, there are healthcare concierge services out there that you can bolt on. So basically just a call center employees can call and they can help them answer benefits questions, navigate finding lower cost providers if they are, if they need an MRI and they're wanting to find a cheaper option than the one that the hospital gave them, they can call these healthcare concierges. So it's worth looking into if that's a pain point for you. And again, they can help employees once the plan is in place do all of this other stuff too. So a lot of help with billing questions, a lot of help with providing education and confirming coverage for employees before they move forward with any services. Similarly, one way to get employees excited about open enrollment, which is really hard to do because their paycheck is most likely about to decrease yet again for a service that they already have. Wellness add-ons and partnerships. So I'm sure many of you worked with Humana when they had the Go 365 program, and that was a phenomenal program, and employees loved it, and it really helped with engagement. People downloaded the app a lot more often. People were up to date on their they were understanding their benefits more, interacting with Humana a whole lot. It really seemed to help the utilization rates. Now that has gone away, Anthem does have I believe it's called Get Strong program, but it is not nearly as robust, and it's really more reimbursements for preventative care. So definitely still worth sharing that information with your employees to help them get excited. But if you have a population that is really into wellness, there are a lot of different add-ons and partners, sometimes at low or no cost to you, that you could add on to help with the engagement. For example, and this is not a pitch for MoveWell. We do not have any clients currently that are using them, but it is something I'm exploring with a client, so I'm putting it in here as an example. MoveWell helps food and activity tracking, wellness and content programs, unlimited coaching with dietitians, PTs. It's a win-win for the employee and for you. The employee is going to get more excited about their benefits. They're going to start interacting and engaging more, but also you are going to hopefully help them to become more healthy and be able to utilize the insurance less, which of course ultimately helps your rates. The other thing, to go back to the slide really quickly, that I would recommend, and I want to be very, very clear, we would never encourage you to encourage or recommend anyone go on Medicare instead of your health plan. Like, that is a decision the employee gets to make. Please do not pressure people to move off of your health plan. That being said, providing access to Medicare information or representatives can be a really useful tool for people who are considering the switch to Medicare, who are thinking about retiring, who are just wanting to weigh all of their options. And again, this is where I would recommend you check with your broker. A lot of brokers will have a Medicare representative that is outside of their company, but that they will refer people to, who will talk to employees for free the first time. And then if they decide to go the Medicare route, they may need to pay or work with someone different, but at least they can get that information up front and use it to help make the best decision for them during open enrollment. So we're going to move on past MoveWell. So of course, thinking about whether digital or in-person open enrollment meetings make the most sense for your population, or potentially doing both. This Brain Shark is really helpful if you do decide to do digital enrollment meetings. We'll talk about Brain Shark in just a minute, but of course, different types of plan documents and tools. We're going to talk about the two most common, and then another one that I would recommend considering. But the SBC is not only hopefully very familiar to you all, but required to be shared with your population. But the thing about the SBC is that it has, and again, I'll share it so that everyone knows what we're talking about, the summary of benefits coverage. This is, of course, for any plan that you would choose. They are supposed to create a document that looks the same way, the same format, so that people can compare across the different options. The part of the SBC that is incredibly helpful that I'm not sure most employees are aware of, or that most employers point people to, is towards the end, this comparison chart. Peg is having a baby, Joe is managing his type 2 diabetes, and Mia has a simple fracture. In every summary of benefits coverage, this exists with, of course, different costs based on how the plan covers these items. So it is incredibly helpful for employees to compare across the different SBCs. And again, it's a tool you already have access to, they already have access to. It's really just reminding them it exists and pointing them in that direction. We'll talk a little bit in a minute about a way to do that, but I do always just like to point that out to people in case you're not that familiar with the summary benefits coverage. So the SBC is shared, of course, with all employees always. Normally, your broker will also put together a very detailed booklet that will break down any insurance coverages that the employees have access to, and that is a fantastic tool, especially for recruiting or for employees to keep for reference. However, I think we all know that during open enrollment, employees tend to get overwhelmed. It is information overload. It is all confusing. It is sometimes scary. So one thing that I recommend considering is starting with just a benefits at a glance one pager with a focus on those key health, vision, dental. So for example, this is a one pager that I have, of course, chopped to fit onto the slide that one of my clients has. They offer 2 health plans. So they will list the health plan information here. Dental, I did cut off vision just for space, but it's a super high level overview of all the coverages, and then of course the cost, because that's the main thing employees want to know. What's it going to cost me, and what are the basic options that I have? That's going to satisfy 80% of your folks. You do have some people that are going to need more information, and you want to have all of the information available, but how you package it is going to make a big difference in how they engage with it. So starting with the benefits at a glance one pager to help kind of launch the open enrollment can sometimes really keep people from getting overwhelmed and give the majority of your people exactly what they need to make their decision. All right. Oh, and then Brainshark. Has anybody on this call worked with Brainshark? A lot of times, this is a great broker tool. They will record themselves or have someone else will record kind of a training on what is covered by the medical plan, or what is covered by the flexible spending account, or what is covered by a medical reimbursement account. And it's almost like a private YouTube. It is a video that they share that is only available via the link, and it has checkpoints. So it will say at minute 2:10, it talks about the grace period. At 5:08, it talks about the what's eligible for coverage and what isn't. And it's a really great way for employees to kind of reference information whenever it's convenient for them in another format, and also to kind of jump to the thing that is most interesting to them. Now, I will say a lot of times with my clients, at least, we are on such a tight timeline that the broker or we do not have time to record something based on the health plan renewal. But one thing that the Brainshark is really good for, and you can reuse it year after year, is if you have flexible spending accounts. Those tend to operate very similarly, other than the monetary limits. Those change every year, as you all know, and it's already been announced, I think, for 2026, the increases. But the plan operation is normally very consistent from year to year if you're not making any giant changes. And so having them do a Brainshark on an FSA or a medical reimbursement account or any of those kind of more standard plans, it can be really helpful, because employees tend to have a lot of questions about those. They can watch the video at their own pace, and you can reuse it year after year. So again, talk to your broker about Brainshark options. If you don't have Brainshark or they don't, there's similar things out there, but having those reference checkpoints so people can jump to different topics within the video is incredibly helpful. Okay, so we've talked about all of those. So this is my favorite part, actually. And Chase, remind me, is it 7 times that employees need to hear something before they are?
Roughly.
Okay. So Chase loves to say employees need to hear things at least 7 times for it to actually resonate, to actually stick with them. So using multi-channel communication channels and strategies is incredibly important if employees are actually going to be able to understand the information and make decisions based off it. So email, of course, I think most of us default to email, but putting resources on the intranet, using webinars or those brain sharks. If you have an emergency notification system, sending out even a text to everyone to just remind them of the time frame of open enrollment and remind them where they can get more information can be very helpful. And then any videos that, again, your broker can provide, or a lot of times, again, your medical reimbursement plan, flexible spending plans, those carriers may even have basic videos on their portal that you are able to utilize, because again, those are pretty standard within certain parameters how they operate. So it's a lot easier to find content that you can share on those that is pre-made. Keep messages short, visual, and mobile friendly. So in theory, the way that this could work is email the entire staff a benefits at a glance one pager via attachment, send them in the body of the email, it says, here are the basic plan changes. And then it includes a bunch of links to, if you need information on X, go here. If you need information on X, go here. And I'm going to show you some examples in a minute. But making sure everyone has access to all of the information is, of course, huge, but making sure you don't overwhelm them with an email with 15 attachments is going to kind of help you get a better response. So my favorite tip is to customize the messaging by audience segment. So think about their lifestyle, their ages, their location. Are they, where in Kentucky are they? As a disclaimer, it is very important that all resources are available to all folks. I think you all know we can't pinpoint, like, run a report and everybody under 35 gets the if you're family planning email. Don't do that. All resources should be available to all folks, but you can have a list of different lifestyle changes or kind of journey checkpoints that people may be on that they can choose for themselves. So including real life examples is going to, again, help people understand the breadth of the benefits that you offer and help them make the best decision for them. So, for example, you could send a list that looks like this. If you are family planning, learn about the prenatal services of the health plan on page 7 of the SBC, and you can link the SBC. Check out information on the disability coverage you offer by clicking on that link. Learn about the organization's parental leave policy here. Link to that. Again, there are, even though open enrollment is really focused on medical, dental, vision, it affects all of your benefits work together. It has an effect on everything. So making people, making them aware of the whole picture, what they have access to in relation to where they are in their journey, is incredibly helpful and is honestly very much appreciated by the people for whom we've tried this. So if you already have kiddos, you can give them resources about telehealth options, learn about the family deductible and how it works. And if they need vision and dental exams, they can check out the cost of family coverage and what's included or excluded on the summary benefits coverage for dental. If you're thinking about retirement, again, this is where you would want to include the Medicare information, but also reminding them to talk to a financial advisor for the 401k, and you can provide their contact information. If you're an adventurer, so I have one client who they all have accident insurance because they're a group of bikers and hikers and climbers. So comparing the cost of breaking a bone on the page 7 of the SBC, or giving them a reminder that you do have accident and disability insurance options. And then this is a question we get a lot about prescription medication. Someone has a very particular drug or dosage that they are on and they want to be sure that it is covered. So you can request a copy of the formulary during your open enrollment process once you finalize the plan and include that. Or you can include information, like if you're working with My Advocate, I would include information there so the advocate could help them look into the prescription coverage. Alternately, sometimes your broker, if you send them the information on the prescription care, they can look it up for you. But either way, making sure that people know if that's something that they are worried about, that they have a very important drug or a very expensive drug and they need to know if it's covered by the health insurance, they know how to reach out to you to get that information. So again, just revisiting this page of the summary benefits coverage, because again, it's my favorite and it is incredibly helpful for folks. So reminding them it is available. And then this is a tool, and I'm happy to share this if you want to shoot me an email after this, but this glossary is an amazing tool to share with everybody. Yes. So somebody else on here, had they used it? So this came from the Office of Information and Regulatory Affairs several years ago, and it is astounding how many people don't understand what coinsurance is or don't understand what the deductible means, but they're too embarrassed to ask. And they wait until they're already in the throes of some kind of health-related issue or having issues with billing, and then they're reaching out and learning after the fact. So sharing this glossary with folks is incredibly simple, but incredibly effective and empowering for employees to help kind of understand their options. All right, so actionable items to streamline open enrollment. So we've talked a little bit about tools, communications, and resources to help people feel engaged. Now we're going to talk about some things on your side to kind of streamline it. So it goes without saying to start planning open enrollment as soon as possible. Often it's not possible to start that early, but start thinking about it in July or August if possible, and go ahead and start determining a plan or building a report or whatever you need to do to gather census information needed for market. So if you are renewing with your existing partner, you normally don't need to provide this census, but if you are looking at any other options, other carriers or other brokers, you may need to provide a census. Most of the census, I've got this kind of one pager here, no matter who you're working with or what carrier, this is generally the information that they need. So what I recommend doing is going ahead and building out a report that will pull all of this for you before you've gotten the census request. And then you can go ahead and run that report when the time comes and reformat it if needed. But at least you've kind of got the main work prepped for, because building the census when you've got really tight turnaround can be really difficult and you don't want to miss anyone or anything and potentially mess with your renewal. So again, this is generally what is needed. This is not 100% of the time every single thing, but this is a really good start if you build a report that includes this information. And then audit your current benefits usage trends and pain points. You were probably already too far into this renewal cycle for this to be something that you utilize this time, but requesting, if you have an employee assistance program, requesting from them usage data to see if it's even being engaged with by employees, and if not, maybe increasing communication about that piece, or doing a survey with your employees to understand from them what's working with the benefits, what they'd like to see that you don't have, or even doing focus groups on benefits. We've had a couple of groups who've wanted to bring in, they've either done a like an employee committee to talk about benefits, or they've done focus groups with just a couple of key groups to understand what's working and what isn't. But either way, getting that feedback is helpful, because if it comes down to it and you need to make a decision between saving money or keeping a robust option, you want to know what your employees really value the most. Would they rather have that extra money in their pocket, or would they rather have the robust healthcare options and pay a little bit more? And then side-by-side plan comparisons and highlighting changes. And this is something not everyone is going to care about, but there are some people who will. And normally when you receive your renewal, you receive something that says current, and then you receive something that says new, and the changes are all highlighted on the new. So using that to just build a very simple illustration that is available to employees about exactly what has changed from one plan to another is highly recommended, because again, people may not understand what coinsurance means, but if they see that their old plan was 20% coinsurance and their new plan is 30% coinsurance, they may bother to go look at the glossary and see what that difference is, because you do not want it to be a surprise, of course. And then Encouraging folks to download the appropriate health app as part of their open enrollment can save you a ton of time. I know you all have probably experienced the pain of the day that the benefits open enrollment is submitted, employees are already asking about their new health cards. Those are not going to be ready. We know that it's going to take several weeks. So there's a couple different ways that you can do this. One is if you are using a like an HRIS system or employee navigator, you can build in some kind of checkpoint at the end when they've hit submit to say, great, your benefits changes have been received. Please take the time now to download the Sydney Health app if you have Anthem or something like that. Similarly, if you are doing it by hand or you are sending the report to the broker, getting all of that sent off and then following up with employees with an email saying, hey, you should expect to see your health insurance cards in the mail in January between the 7th and the 14th. But if you need access to your cards in the meantime, download this app. It is incredibly, it's going to save you a lot of time. It's going to save them some time. And then hopefully will help them to engage more with the health insurance as well, because the app allows them to look for covered providers. In theory, they could search for the formulary themselves. They can go ahead and track usage and get their cards as soon as they're available. It just helps everyone. And then training internal champions with cheat sheets, glossaries, where resources live, etc. It is not realistic or fair to expect most managers to become benefits experts, and that's not at all what I'm recommending here. I would say just create a frequently asked question sheet of the 5 questions that you always get during open enrollment, because we know there are always a couple questions that are repeated, and then ensure that managers just know where to send people for information if you don't want the answer to always be you. So for example, if they want to know about if their provider is covered, they could send them to the app or the website, or to you if you would like to field that question. If they're curious about which plan is right for them, send them to the patient advocate if you have it, or to the AI tool in the HRIS, or to you if you would like to be that person. But just giving them the tools to be able to respond to employee questions with some kind of information is going to make it a little less painful. And then this is the ideal. Use a post-enrollment survey to refine future strategies. During open enrollment, it is really hard to plan ahead for future open enrollment. So I would recommend getting some distance from it, but maybe in February or March, if you have the time and it was an especially painful process, go ahead and do a survey to help ensure that you're kind of refining future strategies and continuing to make adjustments so your population is best served. So we've talked about the census. I'm going to skip that one. And then some other basic HR tips as you're thinking through open enrollment. Framing benefits as part of the total compensation package, of course, is important. If you are able to provide total comp statements, this is a wonderful time to do it, especially if you're a 1/1 renewal. You're reminding employees of how you've supported them through the year with salary, PTO, what you're submitting to their 401k, what you're paying on behalf of them for benefits. However, it is a really heavy lift most of the time to put these total comp statements together. If you don't have a tool, it can be really cumbersome. So it's something great to have, but it is not at all required, but it does do a lot of work for the employees to help demonstrate how much their employer is investing in them and their benefits. And then being transparent about cost changes and plan updates. We've talked about over communicating. And then reinforce key messages year round, not just during open enrollment. So there is that sense of, like I said, for 80% of your employees, they want to see that benefits at a glance one pager and they're done. For the other 20% that are doing more work and digging deep, they are going to have fatigue from this open enrollment and all of the new information they've received. So making sure that you just reinforce some of the great benefits that you offer or great tools that are available as part of your open enrollment later in the year and not just during open enrollment is going to help those really get utilized. And then remembering to highlight underutilized benefits. Again, if that's at open enrollment, if you have that opening and you can tie it into kind of their lifestyle or where they are in the journey, great. If not, I would highlight those underutilized benefits at other points of the year, but just making sure employees remember they are available. Tuition reimbursement, wellness programs, disability plans, all the fantastic things you offer to support them. So, I think think that is the end of this presentation. What questions do you guys have? Hopefully, like I said, hopefully there's at least one thing you've found here that you can take back and implement or explore or think about for next year. But any questions or?
Allison, can I jump in with a couple things? On the open enrollment and like Employee Navigator and everything. So I know there's another system too. I have a client that uses it called EASE, EASE, where that is one. So if they don't have Employee Navigator, they might have EASE, but it also does ACA. So if you're in the ACA realm too, it can track your ACA. I'm not sure about Employee Navigator, but and then in my previous life, unfortunately, we were paper for a long time, and we had Colonial that did all of our ancillary products. They actually were able to do one-on-ones with people. Now it was a win-win, right? They met with them to meet with them to go over Colonial stuff, but they actually did all of the enrollment in their system and then printed me a report to send to the broker. So you might be able to talk to one of your ancillary providers as well, on participating with that, but just wanted to share that too.
I just saw a chat. Do you have an average percentage of increase for the medical insurance for 2026? I don't. I think a lot of them are still outstanding as part of, like, I'm not sure if that data is even available yet, because instead of just of my clients, 2 of the 3, we still don't even have the final renewal. So, but I can say the renewals that I have seen, I got one of our clients proposed a 13% that's being negotiated. One landed at a 5, and one was at a 7 that's being negotiated. What about Chase, Vicky? What do you guys?
Yeah, I had one at 8%, and then there was one that came in unusually high. They're negotiating down. I won't even say that percentage because it's scary, but they're negotiating that one down. But I've seen actually single digits. So
I think mine was the scary one that Vicky doesn't want to say the number, but I think that is going to work itself out. But that was like the outlier.
About those of you on here, what have
7 to 10 is pretty much what I've seen with some of my folks, but
we reviewed our renewal end of the week before, and then we met back again with our broker last week, and we were able to get it's less than 5%.
That's awesome.
yes.
That's great.
that's great.
It's fascinating, guys. I don't know where you got this percent, but I'm scared of those what you don't want to call this high percentage. Let's just leave it because we're still also in consideration process. But Alison, this presentation was very helpful for me. I am new for this field for the benefit and enrollment. It will be my first enrollment period. I am freaking out, not only because it's a percentage going up, but also because it's a very important benefits for the employees, and because it needs to be done right from the beginning. And I think this presentation extremely helpful. If I can have this glossary, what you promoted previously, I would love to have that. Because it's a literally good, I think, base for people to have, start with that. And, Ashley, I don't know if you're going to send us this presentation, but I think it would be great for me to have. And I took some pictures of the slides. But please send it because I think it will be very helpful. Thank you for putting it all together too, because I think it's a very interesting time, and I think it's very helpful information. Thank you so much, guys.
Yeah, happy to share the glossary. I'll send that to you, Ashley, and you can distribute.
Distribute it afterwards.
Yeah, that'd be great. And I can send out the recording, the slides, and the tool. Make sure everyone gets this because this was extremely helpful, Allison. I really appreciate it. And as others think of questions, I had a couple of thoughts, a couple of takeaways from this presentation I wanted to ask you about. One being, you mentioned a couple of times that it seems like there's a really strong interest right now in like mental health benefits and how providers can work on those. All of our health centers on the call right now, most provide behavioral health, mental health services in-house. And I'm curious if
Great.
you've heard of organizations that are doing, some sort of employee benefit process to, either provide free care to employees or significantly discount employees, any way to really leverage that expertise they already have within their organization.
Mm.
Or if anyone on the call is doing it.
Yeah, before I weigh in, I'm curious if anyone on the call is doing it. Because I will say we don't have a lot of clients that I am aware of that have utilized their own services for mental health because it can become complicated if other staff members are doing those mental health discussions or evaluations and that information is available technically to that employee or to the employer, then it can kind of complicate things around ADA or there's a lot of HIPAA related things, of course, that come into play, and I don't have to tell you all about HIPAA. So I will say we don't have a lot of clients who go in that direction, at least that are not huge clients that can create totally separate, like they're working in a totally different building or department where they're not overlapping with anyone. For smaller organizations, we do not see a lot of that. Chase or Vicky, correct me if you disagree.
Julie's got her hand up, but I will say, we have seen some smaller clients that are getting creative though with that. So they may not be able to offer the mental health as part of the their package deal, so to speak, but maybe they're doing something supplemental. Like we've had people that have paid for like those tele app, like what's it called?
Yeah, like Headspace or Talk.
Headspace, like the Calm app, those things, but also what's the telehealth therapy one? I just thought about it the other day. Anyway, they're helping people pay for supplement those costs if it's not a part of the plan.
And
It's Headspace.
Yeah,
Like,
and
there's-
like you said, Allison, there is a conflict between our providers providing behavioral health therapy services to our employees. So we do partner with another FQHC that's close to us, where we will see their employees and then they will see ours. But of course, they do bill,
That's great.
their insurance. So
It's nice.
That's an awesome idea, Jennifer. That's a cool strategy. Yeah.
Jennifer, I'm so
thinking
glad
of.
that you mentioned that. Hi, this is Julie. My hair is a wreck. That's why you don't see my picture. That's a great idea because I was just going to share that at family health centers, it can become a nightmare with that. Now, obviously, if someone is in a crisis situation, we will do that sort of triage, if you will. But try to get them to either our EAP or, to suggest, is there someone we can call? Do we need to, take you to the Brook Hospital or something like that?
Yeah.
I've seen it where a lot of the telehealth mental health visits are no cost. So on some plans. So if they do the telehealth, there's no charge.
Mm-hmm.
And there, in the Forbes article I was reading, one of the top, like it kind of broke down what mental health resources people were interested in. And actually, I was surprised by this, but one of the top ones was dedicated space for processing. So it's not even an extra, you don't even have to, pay anything extra. It's not an actual service so much as it is just a space and a little bit of time to allow people to, when they get stressed or when they are dealing with a serious personal phone call at work, they want space to process and be able to kind of work through those feelings. So
I think
that's
those are called
something to
rage
consider.
rooms.
I called it, we had one where I used to work and I called it the panic room.
The panic room.
Love it.
With some old TVs and some baseball bats in there too. I like that, Allison.
I'm
People
pretty
heading
sure
out.
those HR leaders will be the ones that probably utilize that
Use
space
it the most. Uh-huh.
That's true.
There are days. There are definitely days. That's a good one. People used to have nap pods. Why not those, you know?
Mhm.
Oh man, nap pods.
Another question that came up for me, or a thought early in your presentation, Allison, you mentioned like loan repayment services and sign up some of those kind of like add-on benefits. And all of our health centers are able to offer National Service Corps loan repayment programs as nonprofits. They can do the Public Service Loan Forgiveness Program. They've got really good malpractice coverage through the FTCA. So there's some really good benefits that are built into the program. And I'm curious from our members on the call, are you guys really promoting those during open enrollment, or is there a separate time that you go into those? Like how are you getting the word out? Or I guess documenting really the value add to their compensation of those programs too.
We talk about loan repayment during, it's on the benefits that we offer as part of any of our offer letters that we initially send out. We talk about it during our training center, so our orientation process. It goes out every year because it's part of one of our policies that they have to review. So that's how we do the loan repayment and the tuition reimbursement.
That's great.
Yeah, I think that would be a good if you were someone that was going to do the different lifestyle quadrants too or sections and talk. You could have one for if you are a new graduate or you have you're interested in continuing education, or you could kind of plug it in there too. And then we have a client that they normally push it because they get a lot of new graduates and it's a recruiting tool. They push it in May during graduation time. They get it out to their staff so that they can share it with anybody they might want to refer.
People have time blindness, pay blindness, and benefits blindness. So they tend to remember their benefits at the time of hire, but then there's like a drift over the years of what the benefits entail. I have come to find. Is that true for anybody else?
Absolutely. Good. Well, what other questions? What everyone's just ready to get back and finish open enrollment, right?
Yeah. Let them maximize their time.
I don't know who all, and I don't want to step on any toes, but we do utilize a broker through the Kentucky Not-for-Profit Network, and have had great success. We struggled to get our renewals by even the end of November before. And so that was this online and the open enrollment period was always so stressful. It's my least favorite time of the year. And with it being right at the holidays, it stinks because it is miserable, as you all know. But it is always very helpful, as you have mentioned, to have a broker that has those capabilities, or even some of the online enrollment options. Because again, I used to do the enrollments for each of the individual, like medical, dental, vision, and so I would have to go into each different portal and enroll and make changes and things like that. So definitely getting a company that can help do all of that for you has been a godsend for us. So if you can get one, get one.
Do you want to share who is the broker for K&N's?
I'm sorry,
group?
excuse me. Hub International.
Oh, great. Okay.
Megan Williams is the broker that we specifically work with. And she's
Okay.
local, so she's 20 minutes down the road. So that's wonderful as well.
Awesome. Yeah, they're fantastic.
Well, I guess if there's nothing else, I'll let you guys get back to it.
Sounds good. Thank you all so much.
Thanks so
Allison,
much.
Chase,
you so
Vicky,
much.
this was really helpful. Yeah, and I will send out the recording, the slides, the tools Allison sends, and make sure everyone gets a copy.
I'll send you that glossary right now.
Great.
Thank you
Thank
all.
you so
Have
much,
a good
guys.
one.
Thank
Bye-bye.
you.
Thanks, y'all. Have a good
Take
day.
care. Bye.